Member from Davenport.
Thank you, Mr. Speaker. My question is for the Minister of Health and Long-Term Care. Last week, our government introduced a budget which includes significant investments in health care. In fact, the 2017 budget includes an additional $7 billion for the health care sector over the next 3 years to reduce wait times, provide access to care, and enhance the patient experience. But most importantly, Mr. Speaker, this budget includes funding for priority health care services that will have a real impact for Ontario families. Mr. Speaker, this budget invests in our hospitals, in long-term care homes, in mental health, and in our world-class health care professionals. But, Mr. Speaker, there is one piece of this budget that stands out for me as the member from Davenport more than anything else. Youth and parents in my community are particularly excited about the new OHIP Plus program. Can the Minister of Health and Long-Term Care please inform this House of the historic investment our government is making in Ontario's children and youth?
Thank you. Minister.
Mr. Speaker, it truly is historic, and that's the way it's being described across this country, Mr. Speaker. Pharmacre for Ontarians and for Canadians is so vitally important, that issue of access to medicine. And come January 1st, not sometime deep into the future, potentially, January the 1st of 2018, 4 million Ontarians, including the member from Niagara West Glanbrook, Mr. Speaker, 4 million children and youth under the age of 25 are going to be able to go into pharmacies with their parents, if they're underage, with a prescription from their health care provider and receive absolutely free of charge, no co-payment, no annual deductible, access to 4,400 medications. Drugs for cancer, Mr. Speaker, drugs for rare disease. This is truly a historic moment in Ontario's history and indeed in Canada's history, Mr. Speaker.
Thank you. Supplementary.
Thank you, Minister, for that response, and thank you to the Minister and the Premier for all their hard work and dedication in ensuring access to prescription medications for Ontario's children and youth. As the mother of 2 young boys, I know how important this access is, and this new program will make a tremendous difference for those families who struggle with poverty and social inequality. It's going to give these families and their children in Davenport and across the whole province, Mr. Speaker, a better opportunity to grow strong and healthy and a chance at a brighter future. But most importantly, it is going to impact all of Ontario's children and youth. No matter the circumstances, no matter the socioeconomic status of the child or their parents, all Ontarians under the age of 24 will benefit equally from this program. Speaker, can the Minister of Health and Long-Term Care please share with this House the impact the program will have for Ontario families?
Minister.
Well, Mr. Speaker, this is such an important advancement to Medicare in this province. It's the biggest transformation, I would argue, in the history of the 51 years that Medicare has existed nationally. It provides that national leadership. The Premier, by making this decision and showing such courage, is making that bold statement to the rest of the country, Mr. Speaker, that this can be done. This must be done, Mr. Speaker. Access to medicine is one of the most fundamental issues of health equity. I'm proud to be in a cabinet and part of a caucus with the Premier that has such vision and courage.
The member from Hamilton East, Stony Creek, second time.
This visionary aspect of Medicare, and we're going to deliver it come January 1st.
Answer.
4 million children and youth under the age of 25.
Thank you.